5 disorders of affectivity. Depression, bipolar disorder, cyclothymia, dysthymia and seasonal depressive disorder are part of the affective disorders. We discuss them here. Worldwide, around 280 million people suffer from depression, one of the most common affective disorders. It is a condition that causes great discomfort and interferes with day-to-day life. Let's see what this disease is about and what are the other disorders that are also part of the affective problems. Keep watching, and if you want to see more content, subscribe. What are affective disorders? Affective disorders are those that are linked to dysfunctional or extreme manifestations or expressions of moods. For this reason, they are also known as mood disorders. That is to say, they present themselves as obstacles to a person's daily life, impacting interpersonal and work relationships. Therefore, they affect complete health. Many of these disorders have comorbidity, that is, they coexist with others. Hence the importance of paying attention to them and addressing them in time to prevent the situation from becoming more complex. Some of the most frequent affective disorders are the following: depressive disorder, bipolar disorder, dysthymia, seasonal affective disorder, cyclothymia. You can comment your case to help others. What factors influence affective disorders? For this type of pathological conditions, there is no single factor that intervenes. It is a set of circumstances that include biological, an excess of cortisol over a prolonged period of time, personal. Not everyone has the same threshold of reaction to the same circumstances, life experiences, for example, the parenting style of the parents, social and cultural, among others. Certain life circumstances, such as bereavement, may also explain the onset of these disorders. 1. Depressive disorder. It is characterized by a feeling of sadness, emptiness and discouragement most of the time, loss of interest in things that used to cause pleasure, difficulty concentrating and making decisions, among other symptoms. There may also be body and sleep changes. In some cases, suicidal thoughts may occur. Depression, to be diagnosed as such, requires the permanence of symptoms for at least 2 weeks. 2. Bipolar disorder. As its name indicates, the mood oscillates between two poles, mania and depression or melancholy. In the first case, there is euphoria, excitement, an overly optimistic mood and accelerated thinking, tachypsychosis. During manic episodes, the person may engage in socially risky and inappropriate behavior. In the second case, it is about feeling discouraged, sad, hopeless. There is a tendency to isolation, to sleep too much, to have little energy to carry out activities. Clinically, according to its presentation, it is subdivided into bipolar disorder I and II. Type I is characterized by the presence of manic episodes. Type II is distinguished by hypomania. 3. Dysthymia. Dysthymia is a more chronic and prolonged mood of sadness. For example, when the person refers that he or she feels this way since all his or her life. Some of the symptoms are hopelessness, lack of energy, low self-esteem, insomnia, difficulty in making decisions, among others. 4. Seasonal affective disorder. Seasonal affective disorder is the anguish and sadness that arises and coincides with the change of season. As there are fewer hours of sunlight during the day, it is suspected that there is an underlying biological element that explains it. 5. Cyclothymia. Cyclothymia has emotional ups and downs, but not all the criteria for a diagnosis of bipolar disorder are met. This is why this particular category has been created. Stop stigmatizing mental health problems. The timely approach to mood disorders has a good prognosis, since through different treatments, psychotherapy and pharmacology, remarkable improvements can be obtained in people. However, many do not ask for help, as there is a stigmatizing misconception about having depression or any other mental health disorder. Often, the interpretation of these problems focuses solely and exclusively on the sick person. This person is the one who should be attended to, cared for, and on whom all measures should be taken. For this reason, it is necessary to advance in a greater awareness and empathy to accompany. From psychoeducation, banishing myths, it is possible to prevent and warn when we are in the presence of a major problem. We can also provide resources to patients so that they can have a good quality of life.